I know we're doing it in January 2024, but we wanted to get the data completed for the year so we could look back at the whole year. The goal of this town hall is I'm sending out this video. We're trying to keep it under 10 minutes, just kind of go over the overview of it. You'll have the slides to review as well. You'll be able to preview the video, look at the slides for next week, and then the following week we'll have in-person town halls where we'll really be able to dive in, have some good discussions, and really get into these data points that I'm going to be sharing. But just to kind of give you a preview of what's to come. And so last year, we had a lot of changes in our executive team. And so just wanted to make everyone aware where the current executive leadership team is and who we are. We'll be at the in-person town halls, and each of us will be able to speak to different components of what we're working on, what we're doing, but wanted to introduce that team again as well. And so the focus of this presentation is, if you remember at our Q3 town hall, we debriefed our COSI survey that we took back in June. With that debrief, we found we have a lot of areas to work on, a lot of opportunities to improve. 5 takeaways that we as the admin team really focused on since then is improving our communication. One area we're working to do that is through these town halls and getting that information out. Fixing the root cause of issues, and we'll talk about what we've done around that. Having more updates regarding the quality that's going on in the facility, having an interest in additional employee engagement, and having interest in community engagement. And so we'll speak to all that through this presentation, and then a lot more when we have our in-person meeting. So the first area I wanted to talk about is around getting to the root cause of issues. We felt that, we knew what the problems were, but we weren't fixing them. We would put Band-Aids on them. And so one thing that we've done is we wanted to provide our leaders in the facility training on how to properly do process improvement. And so in October, we had 40 of our leaders over a 2-day period receive their yellow belt in Lean Six Sigma, which is a process improvement methodology used to fix processes, used to get to the root cause of issues and actually change them. From that, we've actually taken 18 of our leaders and they've started a graduate level program that's a three-month course. At the end of it, they'll have their black belt in Lean Six Sigma and be able to really manage in-depth process improvement projects, which take anywhere from 6 to 8 months to complete. So our facility after this, if we complete 18 true black belt level projects, would be fundamentally different. So I'm really excited to see how this progresses and goes, but wanted to show you that we took that feedback seriously and are trying to invest resources into getting the root cause of issues here at the building. Next, this is our quality balance scorecard. You should see this throughout the facility. This is how we hold ourselves accountable to quality. We'll dive into each of these areas during our in-person town hall, but I wanted you to be aware of this scorecard. Look for it. If you don't see it in your areas, talk to your managers, bring it up during our town hall, and we'll make sure to provide it to you or get it posted in an area that you can see, because this is how we keep ourselves honest on our journey to becoming a high reliability organization. Specifically, we had talked about the ED and the process and the changes we had made there. One thing we're currently, for the past 2 months, been having a patient surge. I'm sure you guys are all feeling this, specifically around RSV, flu, and COVID. And so our building's been full for the past 2 months. With that, our operational metrics that we track in the ED haven't been headed in the direction we want it to, specifically around LWATs, AMAs, dispositions, different metrics operationally that you track in the ED. However, our quality metrics have been improving and have stayed consistent. So even though it's been very full, we've been able to continue to provide excellent care to our patients. Looking specifically at chest pain, when a chest pain patient comes in the building, if you remember from our last town hall, the national metric is 10 minutes. This is a metric that the hospital had never hit before February of 2023. And not only have we hit it, we've improved it, and we've continued to be consistent with that metric. So very proud of the ED team and the hard work they're doing there. I know it hasn't been easy with the surge we've been having, but they've been doing a phenomenal job. This is another way to look at that information, specifically around the percentage of patients that meet that 10-minute mark. And so just another way to track it, to make sure that even though our average time is good, we want to make sure that the percentage of patients that we're seeing meet that 10-minute mark. Another area around quality I wanted to touch on is, since we last met, we were able to celebrate 365 days of being CODI free in the facility. We had a big celebration. We had served omelets to everyone. We had the tagline, "We provide excellent care." So that was a lot of fun. I appreciate everyone's hard work with that. Specifically around quality, we've been able to invest resources around giving better quality. Two things we celebrated was, we had our radiation oncology linear accelerator ribbon cutting, happened June 13th. That was a $5 million project. And then we had our new ICU ribbon cutting open house, where it was a capstone of a $120 million investment that we've had at the facility over the past 7 years. And so excited about that new area and the expansion of beds we're able to provide as we expanded the ICU beds that we have here in Wilson. So these next 4 slides I'm really excited about. We had that consistent feedback that we wanted to have more employee engagement. We wanted to have more community engagement. And so we really took that feedback seriously, and we formed 2 committees. We formed an employee engagement committee. That committee is chaired currently by our People Services Director, or HR Director, Danielle Vick. And their purpose that they created was aiming to promote a positive workplace culture and create opportunities for employees to engage with each other and the organization. And our goal with that is, we want to do 1 event for our staff a month, and they've exceeded in that with the things we've done since August when we formed this committee. If you're interested in serving on that committee, please reach out to Danielle Vick. We're always looking for new members to help us with that. Here are some of the pictures that we had at these local events. Some of the fun ones. I really enjoyed when we did the excellent care, and I was able to cook some omelets. Enjoyed being dunked in the booth on the hot summer day. And then you can see this picture up here in the right corner. They got me to dress up as the Grinch at our Santa event. Very hot suit, but the kids seemed to enjoy it, so it went well. Looking at community engagement, we formed this one in the summer, and we've been able to have an event every month since there, and each event has progressively gotten better. It's just been a real excellent opportunity to get engaged in the community. And so in our town hall, we'll go into each of these events and how they went, and appreciate everyone's involvement in helping us to engage in the community. And then also, here are some pictures from those events, and really appreciate everyone's feedback, and that we were able to create this committee to meet those needs that you guys have of wanting to be better involved in the community. So some things to look forward to in 2024. We're the sponsor of a local chamber event. We're going to start that We Are Wilson 2.0 campaign that we did last year, went very well. And then in August, we're gonna celebrate our 60th birthday. So that'll be a huge event. So more to come with that. Remember, as follow-up, we'll see you guys in 2 weeks in person, where we'll be able to have more in-depth conversation about these things. But appreciate everything you're doing, and Happy New Year.